delighted to introduce our student speakers again. And I say student speakers, and actually that's a slight mistruth, because they are final year medical students and junior doctors who are KCL alumni. And Sarah, who is just about to appear on the screen, has worked with us before, so some of you may have seen her. She did a scholarly project module with me in year 2, which seems like a long time ago now, Sarah, and did some brilliant research that's been published on patient narratives of their first smear. And her and her colleagues today, as well as being busy studying and working, have found time, I'm so impressed with you guys, to do some amazing research and really interesting research that I hope they can get published about my Corona Coaster. So exploring long COVID stories from Instagram captions. So I'll hand over to Sarah Chipson, Matthew Knight, Ben Brown, and Mary Donkor.
Hi, I hope you can all see the slides. So I'll start. My name's Sarah. I'm one of the students that's been working on this project along with Mary, Ben and Matthew, and we're going to be sharing some of the things we found about long COVID, looking at Instagram captions, and we've been analysing Instagram captions that people have been posting about their experience of long COVID. So I'll quickly go through the background and methods, and then I'll hand over to the others who are going to present some of our findings, which I'm sure are much more interesting for you. So the background on long COVID, 1 in 10 COVID patients experience symptoms 12 weeks later. So it's quite common. Reported symptoms are wide ranging. You can see in this diagram here. They include things like fatigue, headache, loss of smell, muscle pain, skin rashes, respiratory problems. I'm sure as GPs you've seen a lot of these patients with, I did in my GP placement see a lot of patients with like persistent loss of smell and things and phoning up. So it's very prevalent. But the term long COVID was actually coined directly by patients on Twitter long before any of the published research was coming out and before any of like science had kind of caught up with it. Patients were discussing the fact that they had these persistent symptoms online, and they came up with this term long COVID to describe it. There's a few qualitative studies that have been done into long COVID and also into online chronic illness communities. So this study by Kingold et al. Looked at more broadly online chronic illness communities and found these different domains that people talk about. Work and identity around their illness. They used it for social support and to connect with one another. They used it to share knowledge about the condition and also to mobilise and do political things and activism, that kind of thing. And you can see here, this is one of the, for COVID, long COVID, this is one of the petitions that was going out to the Canadian government that people were advertising online, and that kind of activism that was going on to raise awareness. The long COVID qualitative papers, there have been a few mainly done in the kind of GP setting, and some of the themes that have come out are things such as the relationship with the medical establishment, finding the right GP, someone who would listen to them. There was also a study done on doctors who had long COVID and their feelings about having long COVID and kind of being a patient, but also a doctor. And they talked about being a reluctant pioneer and being some of the first people to have this new illness and how that affected them. So there's been several studies done on this kind of thing, but they've all used traditional qualitative methods, although I did find the other day, there's just recently been one published also looking at online experiences. But when we started this study, we were the only ones, the first people to kind of be looking at online experiences. So they've all looked at interviews or focus groups, that kind of thing, rather than looking at online dialogue. So our aim was to explore those experiences of people living with long COVID and what they'd shared on Instagram about those experiences. So here's some of the methods that I'll just go through briefly. We did a single search of the hashtag long COVID on Instagram. And as you can see, we analysed almost 500 captions, so 496 captions in the end, after using our inclusion and exclusion criteria. And we double coded all of them. So every caption was looked at and coded by 2 people, and we did thematic analysis. Some of the reasons why we chose Instagram are because they have public posts compared to things like Facebook, where it's much more private, and that would have a kind of ethical concern if we were just looking at people's posts that they posted for their private use, whereas the Instagram posts we looked at were all public. They have longer posts compared to platforms such as Twitter that either limit the characters or people tend to not post as long threads on there. So looking at Instagram meant we have a bit more narrative to use and look into those people's experiences in a bit more depth. We all had familiarity with the platform. We all use Instagram, the researchers, so we were a bit more familiar with how it's used, what kind of things people post on there, and that would help us to do the research. And also there is some evidence that there might be a slightly more diverse demographic on Instagram compared to some other platforms. Instagram doesn't actually release its demographic data, but there's a few reports and studies that have shown that it might have, especially in the US, a bit more diversity, ethnic diversity in particular.
Thank you, Sarah. So I'm just going to talk through the results of what we found. So just in terms of analysing the captions and coding them, there were 496 captions in total, which varied in length from single sentences of about 11 words all the way up to over 1,000 words of quite lengthy posts in quite a lot of detail. And the number of captions that each account posted that was related to long COVID varied as well, from just a single caption up to 35 individuals who were almost using their Instagram account as a journal to document their long COVID experience over a couple of years. So after coding, all of us 4 researchers reached a consensus on the main themes present in the narratives, and we identified 3 main themes. So the first theme was looking at the identity change that individuals undergo with the onset of illness and how they are forced to adapt to the constraints of long COVID. So looking at the first caption in the top left, we know that for example, middle-aged women are most likely to report symptoms of long COVID, and many of these individuals were highly functioning and healthy individuals prior to becoming unwell. So in the first caption, we can see that the person sees a clear divide between the successful person they were before they became ill and their new illness identity. On the right-hand side, we can also see the concept of energy rationing played a large part in the lives of some individuals who were having to learn to live the best life they could within their new self-assigned energy rations. And on the bottom left, we can see that for many people, they took a lot of comfort from connecting with fellow long haulers, so other people suffering from long COVID, particularly in reducing that sense of isolation that comes with suffering from a novel illness. And also, for many people, they found a way of coping with the difficulties was to try and reframe the experience as strengthening them and providing a fulfilling experience. Next slide, please. So the second theme was titled Corona Coaster of Uncertainty, which is a term that was coined by long haulers in their posts, and they used it to describe the many aspects of uncertainty that long COVID brings. In the first caption, we can see how the daily unpredictability of symptoms prevented individuals from making plans, and many accounts reported having to cancel plans due to a relapse of symptoms, which significantly reduced their quality of life. And unfortunately, the severity of long COVID has meant many individuals have been unable to return to work for long periods, which makes them very vulnerable financially, but also brings into question their professional identity as individuals. And finally, as well, just the novel nature of the illness means that the timeline to recovery is still not established. We don't know how long people will suffer for. And that means that many people are left wondering, will I ever return to normality?
Hi there, can everyone hear me? Great. Yeah, my name's Ben, and I'm introducing theme 3, which is this relationship with the medical establishment. As Sarah touched on already, there have been a few studies that have looked into this, but I'm going to talk specifically about our findings, which were that especially initially people were pointing out they weren't being taken seriously by healthcare professionals. Obviously, this was not the only viewpoint. We had quite a few that actually really highlighted a really positive relationship with their doctors, and how that had helped them get the right interventions and the right investigations in order to help them to massively improve their lives. But there were those few who highlighted that they felt that, and as you can see in the quotes here, I see a GP writing, I see a young lady who isn't sick, and symptoms don't seem to be related to COVID. They felt that, well, they had a strong feeling that their symptoms were related to COVID. They found they weren't always taken seriously. As can be seen in the last couple of lines, that was even in some cases, and I think we picked one of the more extreme cases here, considered gaslighting, and it was highlighted that potentially this was happening in ethnic minority groups more so than in white populations. Following on from that, we also see that there's those that really felt they were let down by medical investigations. They felt that again their symptoms the results from those investigations weren't coherent with their symptoms, and that led them to seek out alternatives. I think a big thing about that was that they were able to take control, and there were a lot of people not only writing about taking sort of herbal remedies, but often taking control of their diets and how that helped them sort of come to terms with their condition. That being said, obviously there were still patients or individuals who really found they were helped by the medical community. But again, in those cases, a lot of the time, they highlighted the fact that there was something they were able to be given by their doctor that enabled them to feel that they were taking control. And one of those big things was vaccination, and actually quite a few highlighted that after being vaccinated, they found that their symptoms improved significantly. Next slide, please. So obviously, with using Instagram on its own, there were some strengths and limitations. Instagram is a very diversely used and very widely used platform, and often sort of used as a diary by a lot of individuals. So they'll often post a picture with an update, and some people will post every day, and that allows a really sort of up-to-date view of how someone is doing. And rather than doing an interview where people have to think back and recall a period of several months, you actually be able to really track people's progress. Obviously, there are some limitations with it as well, in that we weren't able to record specific participant data, so we weren't really able to record what healthcare system people were using, i.e. were they on the NHS or were they using private healthcare, and a lot of our patients weren't UK based either, or a lot of our participants, weren't UK based either. We were also not able to record age or ethnicity or economic status. We possibly could push this study further by looking into the comment section, and obviously, as we all know, that persona that people use online is not necessarily a fair representation of how they are in real life, and often within social media there's an emphasis on being extreme or being or overly dramatizing something, or even under dramatizing something in order to sort of suit your narrative. Yeah, and the final sort of weakness we identified is that we're all from the same background. All 4 of us have a very similar age range and studying at medical school. So obviously our interpretation may be different to someone who is at a different age or has different life experience to us.
Yeah, so just to summarize the main takeaways from our research, we found that people who are living with long COVID, they have significant changes to their life, mainly in their kind of identity, like how they perceive their identity, and also kind of how they operate in the world, their energy levels and what they're able to do. And related to that, we found that uncertainty was a big influencing factor, something that affected lots of patients, and the uncertainty meant a lot of people had to adapt in certain ways or reframe in certain ways, either their perception of themselves or their chronic illness, or approaching life in a different way. Also, one of the other things we found was that because it's such an emerging condition, that there is a very complex relationship with the medical establishment and how patients feel supported, and how healthcare professionals and how patients advocate for people with long COVID, or don't advocate for those. We did also find that our findings were kind of had similarities with previous studies, and in terms of the themes that we uncovered, and even some of the like uncertainty, and even some of the way that people were describing their experiences living with chronic illness. Another interesting thing that came out was the impact of the socio-political context, and kind of in 2020 and 2021, there was a greater awareness of kind of social injustice just generally, kind of, for example, the Black Lives Matter protests, and lots of different things going on, whilst a lot of people were at home and had more time to direct to thinking about these issues. So we found that that influenced the way people experienced long COVID and managed that. And all of our findings kind of suggest that we should probably look towards curating and creating services specifically for people suffering with long COVID, and helping medical professionals to understand these patients and advocate for them more specifically. Thanks very much.
Thank you so much. What a fascinating presentation of the research that you did, and an amazing and really positive way that you've used social media